Hey everyone, welcome. Today we're going to break down the clinical profile of a medication you've probably heard of, Lorazepam. Our goal is to get a really clear, straightforward look at what it is, how it's used, and of course, all the critical safety info that comes with it.
All right, let's dive right in. Here's our game plan for today. We'll kick things off with the basics of what Lorazepam actually is. Then, we'll get into its medical uses, cover the really important risks, see how it's administered, and wrap up with the most crucial safety points you need to remember.
So, first things first, what exactly is Lorazepam? To really get a handle on how it works, we've got to start with the family of drugs it belongs to.
Okay, so Lorazepam is a benzodiazepine, and that's a class of drugs famous for having a calming or sedating effect on the central nervous system. That right there explains why it's so useful for things like anxiety and for stopping convulsions.
But how does it create that calming effect? Well, in a nutshell, it dials down overactive electrical signals in the brain. The best way to picture it is like a dimmer switch for your central nervous system. It just turns down the intensity of those signals that might be causing a seizure or intense anxiety.
Now, one of the most incredible things about Lorazepam is how fast it works. When it's given intravenously, that's through an IV, the effects can kick in, get this, in just 2 to 10 minutes. And those effects will typically last for about 6 to 8 hours. That speed is exactly why it's such a game changer in medical emergencies.
Okay, so we know what it is, and we know it works fast. The next logical question is, when do doctors actually use it? Let's look at the key medical situations where Lorazepam comes into play. And its uses are pretty wide-ranging. It's a go-to for stopping active seizures, including a really dangerous condition called status epilepticus. That's a seizure that just won't stop on its own. It's also used to calm someone down who's severely agitated, to help manage severe alcohol withdrawal, treat intense anxiety, and even to control shivering by relaxing the muscles.
All right, now for the other side of the coin. With any medication this effective, there are always potential risks. And this next part is super important, because understanding the cautions is every bit as vital as knowing the benefits. This slide breaks down the risks into two really clear buckets. On the left, you've got contraindications. These are basically the stop sign situations where the drug just shouldn't be used at all, like with certain types of glaucoma, which is an eye condition, or if a patient's breathing is already dangerously slow. Then on the right, you have adverse reactions. These are potential side effects to watch out for, like becoming too sleepy or seeing changes in heart rate and blood pressure.
And this is a huge one. It's absolutely critical to think about how Lorazepam might interact with other things. A major warning is that if you combine it with other central nervous system depressants, and that includes things like opioids or alcohol, it can seriously ramp up the sedation and dangerously slow down breathing and impair motor control.
Okay, let's switch gears and get into the practical side of things. How is this medication actually prepared and given to a patient? The details here really matter.
This part is super simple, but it is absolutely non-negotiable for safety. There are two golden rules for giving this drug. For IV use, it has to be diluted. But for an intramuscular injection, that's an IM shot, you do not dilute it. Getting this right is everything.
And of course, dosage isn't a one-size-fits-all situation. The right amount really depends on the patient and their specific condition. For example, if you look at the dose for seizures, it's carefully calculated based on body weight for both adults and kids to be super precise. But for agitation in an adult, it's often a standard fixed amount.
And that brings us to our final, and you could argue, our most important section. This is where we pull all the most serious warnings and monitoring requirements together, the absolute must-knows for any healthcare provider.
This quote here points to a very serious issue around pregnancy. Using Lorazepam, especially later on, can cause real problems for the newborn. We're talking about withdrawal symptoms and something called floppy infant syndrome, where the baby has very poor muscle tone. This is exactly why it's a careful balancing act of risks and benefits for any pregnant patient.
So, the biggest takeaway here is that using this drug safely is about so much more than just the right dose. It requires constant vigilance. That means keeping a close eye on breathing and blood pressure, having emergency equipment ready to go, and doing those simple but vital checks, like making sure the medication isn't expired or discolored.
Whew! We have covered a lot of ground today, from how it works to those crucial safety checks. Now remember, none of this is medical advice. It's a tool to help you be a more informed participant in your own healthcare. The goal is to empower you to ask great questions. So, as we wrap up, I want you to think about this.
What's the #1 question this explainer has sparked for your next conversation with a healthcare professional?